Before I said that coronavirus isn't funny. It's not funny. It is affecting people's livelihoods, their ability to provide and protect for their family because they're not working. Unemployment isn't kicking in. Stimulus checks are just not enough. About to be a fight now that we're in July and got to see if the HEROES Act actually passes, what the Republicans want to strip away, what the Democrats want to strip away or add. The constant back and forth negotiating when people are in need and do need help. Does the health industry need more funding so the ability to test, or is it the test being selective to certain individuals because they're more important than others? So many things, so many questions unanswered, so many possibilities endlessly that we want to converse and talk about. It's just ridiculous. Let's get to the root of it. Let's do what it is that we need to do to ensure the American people are at peace, at least when it comes to the ability to afford their bills, when before they were just paying them. So let's do what it is that we need to do. Republicans, Democrats, Independents, Boston Tea Party, whatever you may deem yourself, let's do what it is we need to do. The health industry, obviously my wife is a nurse, they need support. Give them the injection of cash that they need to ensure that they have all the tools necessary to combat and get this thing under control. The lackadaisicalness of our administration of this country has put us in a precarious situation as to why we are dealing with this the way that we are dealing with it. We're rolling around like a bunch of chickens with their heads cut off. Plainly, that is true. Plainly, we can see that as transparently as ever. And ever is the first time, because we've never had to gone through anything like this before, at least not in my lifetime. So give them the money that they need, the coronavirus. There's simple things that they need. Obviously, they need to hire more individuals to go ahead and help with the testing centers around this country. We obviously do need more of them. We have not tested all 330 million plus Americans in this country yet. So the more that we can test, the more data and the more data that they have to go ahead and know what it is that's going on. Where is it coming from? How it got here? How did you get this virus? Tracing, obviously, it sucks right now. It's not good. They need to do a better job at it. But this is where it does kind of get a little bit funny. I cannot find the video to put it in post, but bear with me. I'm gonna give you the greatest visual I possibly can. There's this young gentleman. He's running down. He sees a fine girl. Dang. She got the hips and the dips, but he's focused on his run and he's jogging. He's jogging. He gets closer to her. He starts thinking, man, maybe I should holler at this girl. It might be my opportunity. She can see that I'm fit. She can see the skin that's glistening, the melanin on my skin as a man is popping and the guns are out. The veins are speaking to everybody out there. They're wishing away the flies and the bugs. They just, He gets closer to her. And she gets closer to him as she goes about her walk, listening to her music, doing her own thing. Obviously, she knows what the good Lord blessed her with, so people are going to be looking. Now they're nearly side by side and she decides to sneeze. At this instant, he does not know what's going on. It could be the time in which the COVID takes me out. And so he dives and dodges over to the left. But unfortunately, there was something there to prevent him from entering the street. And that was the light post. The light post ate his shoulder up and he came tumbling down. The girl looked back at him, even though it was just a regular old sneeze, and just laughed and then kept on walking. His opportunity is now lost. That, I said with a straight face, but I'm trying my best not to laugh. Contact tracing, they're thinking about implementing it through Apple and Google with the apps. So that way you're well aware and you know who has the virus. Obviously, they should have the mask on if they have the virus, and you will know because of the contact tracing, which will better improve the health industry's ability to eradicate or better yet control the coronavirus up until that they have an effective response to the virus in which people are not drastically affected by it, dying from it, experiencing complications. I think this is a very interesting way, but then it is releasing a lot of your personal information as well, but we need to do something. I can just see it now, a whole bunch of people walking by and their phone keeps buzzing because someone has it. And the moment that person looks at them, I see people running away in fear. So I do not know if this is going to work, but it is a step in the right direction. They're trying to be creative. They're trying to find ways to combat this because they were unprepared. They did not have the resources prior to, as they did before, to ensure that they properly inform the President of the United States on what it is that they need to do to prevent it from even affecting this country. Now we all see how delicate our economic system is. We are literally paycheck to paycheck, from the lowest income earner to the highest income profit-bearing Fortune 201 company. Check to check. It's a rotation. Our economy is simple. From the bottom up and from the top to the bottom is where it should be as well. The money just keeps circulating. But it's not, because the virus is real and it's affecting everybody. So I hope you guys enjoyed this video, but I do want you guys to give big shout out, big love, big respect to the health industry workers as they're doing their best. And us as common, ordinary people who are not in the health care industry, let us do our due diligence by following the rules and regulations that are set in place to give them the time that they need to give us an effective response to this virus. We need it. I don't know if I'm not experienced in this world, but of course viruses can mutate, they can turn into certain things, and we don't want any of that to happen. We do not. We don't need no Resident Evil type stuff happening, which a lot of people I've been seeing are feeling this could turn into. Be at peace, be at calm, do what is necessary, do what the healthcare organization is asking you to do. If you're feeling some type of way, go get tested. Even if you're not feeling some type of way, go get tested. Find a testing center, do what it is that you can. If you're unable to, because there isn't one in your spot just yet, stay home. Continue to do it. Do not allow your state or any city, locality, country, president to sway you to the left or sway you to the right, because it is clear that the reopening of the states, the reopening of its economy, is based on the sin of capitalism, the sin of people wanting to be greedy, to want to get back to making that money. If you would have just done it right the first time, you wouldn't even put yourself in a position to be tested in this manner. But regardless of the fact, it is what it is. And we have to do what is necessary to keep each other safe, because that is first and foremost the number one thing. If there's no one here, no money can be made. So at least look at it from that approach.